What are the symptoms of COVID? What can you do if you think you have COVID symptoms? And if you need to go for a COVID test, what kind of test should you choose? If you are interested in any of these topics, hit the like button and we'll dive right into it. The most common COVID symptoms are fever, dry cough, and fatigue or tiredness. The less common symptoms are loss of taste or smell, aches and pains, sore throat, diarrhea, conjunctivitis or redness of eyes, headaches, rashes, and nails discoloration. The severe COVID symptoms are shortness of breath, chest pain or pressure, and loss of speech or movement. If anyone around you is having any of the severe symptoms, head to the emergency department of your local hospital immediately. What can you do if you are feeling unwell and you think you have COVID symptoms? Should you go and get tested? First, ask yourself this question. Have you come into close contact with any COVID positive patient recently? Have you traveled abroad for the past 14 days? If your answer is yes, Ministry of Health is most likely to have identified you as a close contact, and please wait for the ministry officials to contact you. If you are from Malaysia, you can call Ministry of Health hotline 15999 to find out whether or not you should go for a COVID test. If your answer is no, testing will not be mandatory, but it will be great if you decide to go for a test for the sake of everybody around you. What types of tests are available for COVID? And if you are going in for a test, which type should you choose? There are three common types of tests for COVID, in which two of them are commonly used. The first one, RT-PCR test, reverse transcription polymerase chain reaction test. It is conducted by using this swab going into your nose, and the specimen has to be sent to a lab. This is the gold standard for COVID tests, but it is more expensive, usually costing 250 to 350 ringgit or 60 to 90 USD, and this is more time consuming, where it may take 24 hours up to 72 hours before the results can get back to you. The second type, RTK antigen test, which, in a full form, rapid test kit for viral antigen. This test is also conducted with a swab, and it tests for the presence of COVID virus antigen structure. The advantages of this test are, number one, it gives you test result on the spot within 15 minutes. And number two, it can be cheaper compared to the PCR test, which is around 150 to 200 ringgit or 40 to 60 US dollars. Some non-profit organizations are even offering this test as low as 70 ringgit or 20 US dollars. The disadvantage of this test is that it is almost as accurate as PCR test, but not quite. So if you are tested positive on RTK test, it is mandatory for you to go for one more round of PCR test for confirmation. The third type is called RTK antibody test. It is conducted by using a drop of blood from your fingertip, and it is not commonly used because it only proves that you have previously been exposed to the COVID virus before, even if you are now completely recovered from it. So in conclusion, which type of test you should go for depends on your local authorities and organizations. And if you are going to travel, please check with your airline beforehand which type of test will be accepted. That's all for this video. But 95% of you who watch my videos are not subscribed to my channel. If you think this information is helpful, Do subscribe to Gigi Han and click that bell icon so you'll be notified when I upload my next video. That's all for now. We'll see you in the next one. Gigi Han out. The first one, RT-PCR test. Polymerase